back to Clinical Breakroom podcast. I am one of your hosts, Alexis Kirkpatrick, and my husband.
Will Kirkpatrick.
We're going to talk about 3 significant nursing topics.
Issues going on around the world. We wanted to talk
Yes.
about the nursing shortage, nursing violence, and then the big medication issue in the U.S. in general. So we wanted to first start talking about the nursing shortage because everyone talks about that, but no one really actually dives deep into the statistics. And also, since we're nurses and with me directly having hospital experience and kind of seeing it for myself of what's going on out there, it'd be kind of cool to get that out to the public and kind of open your guys' eyes and what it means, what a nursing shortage actually means for not just the United States, but the entire world. So I wanted to go ahead and put some facts out there that there is expected to be a growth of nurses in the workforce from 3.1 million. So currently we have 3.1 million, and this is 2021 statistics. And we're supposed to grow to 3.3 million in 2031, which is only a 195,000 addition to what we currently have. And what the statistic is showing right now is that we are projecting to have over 203,000 jobs for RNs open and not filled throughout the year of 2031. So the projections, the numbers are not going in our favor of how fast we actually need to grow the nursing workforce. So of course, demand is very high, and that's always a good career to go into if you're thinking about being a nurse. But there's probably lots of people who are, questioning if that's the right move, of course. And everybody kind of questions. I feel like if they go into nursing school, I'm like, is it? Everyone hears horror stories about nursing, which we'll kind of get into all the different things. But yeah, so nursing shortage is a huge, very real issue going on, not just in the U.S. but everywhere. There's just simply not enough nurses, and especially the U.S. Everyone talks about those baby boomers that are just getting older and older,
Mhm.
and there's not going to be very many people to take care of them. And as of course, as we get old, there's likely going to be some sort of hospitalization if you're reaching over 75 years old, especially. So we wanted to talk about, why is there a nursing shortage and kind of what our experience is it like what our experience is personally. So more statistics also is that all while we have a nursing shortage, we have a nursing education shortage. So there's just as much of a nursing instructor shortage as there is a nurses at the bedside. So, and when we talk about shortage, it's nurses at the bedside. Like we can't keep nurses in the hospital setting because of the issues going on with that. So, not sure if you guys know about it, but we have a waiting list of nursing applicants over 90,000. So, all while we have this giant nursing shortage where we need 203,000 jobs filled that aren't being filled every year, all the way until 2031, they're projecting, we also have a waiting list with these nursing schools that are not even able to supply the nursing workforce in a sufficient way because there's a shortage of nursing instructors. So, we going through nursing school, we went through a community college, so we didn't really have a whole lot of shortages with instructors. I feel like we were, you know, supported pretty well going through nursing school. But there's definitely a lot of colleges out there right now that their capacity is this, and they can't grow because they don't have enough people to actually take them in. So
Yeah.
it's
How
an
many
issue.
how many nursing students got denied because of the lack of instructors?
Well, it says over 90,000 in the year of 2021 alone, just that school year. So in a 1 year period, that was over 90,000 people that could have been nurses in 2 years if they were doing associates
It's
that aren't going to be
crazy.
nurses now. They have to wait. And when people wait, they're not going to just wait around for a profession. Many of them don't end up doing
Yeah, you have
another
to.
job. Like, you got to live and provide
Yeah.
for your family. So, you know,
When we were in nursing school, we started out with like 100 students, and then over time people like would fail out or they would just drop, and so we graduated with what, 40, you think?
yeah, probably, yeah, around there or even less, maybe.
So that's also an issue, is just lazy people.
Yeah, and it also says that the median age for a nurse right now is 46 years old,
Wow.
which tells you that there's not very many young
Retirement.
people. Yeah, and
Yeah.
you don't have many years of. That's exactly why they're projecting over 200,000 jobs being open through the year of 2031 because a lot of those nurses are already older, and they're and a lot of them, especially when you get older, you don't want to be in the hospital setting because it is a rough
Yeah.
job on your body, and of course mentally too. So yeah, it's definitely an issue. And we also had last statistic before we kind of start talking about our personal experiences that we've had the biggest exit of the nursing profession after COVID. So between 2020 and 2021, we had over 100,000 nurses leave the nursing profession, with most of those being under the age of 35 years old. They just completely left nursing altogether. They went to a different industry, or they're not coming back. So that was the biggest in, said, 4 decades.
Hmm.
Biggest exit in 4 decades. Which everyone likes to talk about how COVID was like the issue of why that happened. Well, it was happening before COVID ever happened. There's a problem with our healthcare system in general in the U.S., especially, that is not very supportive of healthcare workers. So it's not just nurses, but nurses are the biggest profession in healthcare by numbers. We have over, like I said, over 3.1 million nurses in the U.S., which is pretty big, and that is the largest profession in the healthcare. So that's it. Just goes to show you that we have a huge shortage. We need more nurses, so we need more support. What's the reason why these nurses are leaving, and what's the reason why people don't want to get into nursing? So, um, I had some opinions on that specifically. Is that the biggest thing that we saw too? That a lot of the nurses that do leave, they're under 1 year of experience. There's like not much support. I mean, even with you, I know you Lexi didn't go into a hospital when she first came out of school, which is totally
On
fine.
purpose.
Yeah, exactly. But I went into the hospital for my first job, and the transition to practice. So like when you get out of school, the school didn't really prepare us for like the real world, at least for me. Now it might be different for you, but at least for me, I didn't really feel completely prepared. Like there's those little things that you just don't know until you're on the job. But the thing with nursing is you really don't get much time to actually learn what you need to know
Well, you
before you're on your
can't
own.
because you when you're in the hospital and you're a nursing student, you can't do a lot of things just because
Yeah.
it's a liability.
Yeah, they don't want you to, obviously, I mean, rightfully so. They don't want
Yeah.
patients to, be harmed. And this is exactly what the problem is with nursing shortage. We have nobody to teach these new nurses. There's nobody really precepting them the right way. I mean, people that are precepting you have less than 1 year of experience themselves. I
Yeah.
mean, there's charge nurses that have one less of experience in a lot of hospitals, which I'm not saying there's some people that have like, if you're good at your job, you're good at your job. I'm not saying, not, downgrading that if you have less than 1 year of experience that you shouldn't be a charge nurse. I'm not saying that at all, but it is, it goes to show that they can't really keep nurses in the hospital because of the toxic
Burnout.
environment, burnout. Yeah. And I'm not sure if you guys know, if you've ever been in a hospital, but it's a pretty high stress job no matter kind of where you go and what unit you're working in. Nurses, a lot of people think nurses just spend their day, doing assistance in like daily living care. They wipe butts all day and all that, but or they say, oh, they just pass meds, they just do that, and the doctor does everything else. And no, but nurses are customer service, they're janitors, they're cafeteria workers, they're everything you can possibly think of. When if there's something, if a resource fails in the hospital, it's the nurse's job to pick it up. Like that's just facts. Like the nurse has to do pretty much everything. They have to be an electrician. They have
You're a
to
mental
figure out,
health counselor.
yeah. If the
You're
TV
the
goes,
chaplain.
yeah, if the TV goes out, you have to figure out your channel for your patient. You have to go have to redo their laundry. It's just like there's just like so many things that fall onto the nurse every single day. Um, and my personal experience is like I got precepted, which I feel like I got lucky compared to
You had a good
yeah, I did. And,
preceptor.
that's probably why I stayed in the hospital longer than most do. At least with our age, anyways, um, is I had a good group around me. Now, but I hear all the time, on our Facebook groups and stuff that nurse students will come out of school, they'll go through a residency program, and then there's not very much support after that. There's like the healthcare system's not going to be supporting you. you get put into a crappy contract by that hospital. You have to
Mhm.
stay for 2 years. And if you
Yeah.
don't, then you pay them money back. It's just like such a toxic thing. And
Mm.
not very many people who, like, generally, people would not like to sign a contract like that. But that's like the only thing available for nurses. And they get put into this crappy situation where there's a nursing shortage. So you get over assigned patients. And I'm not sure if you guys know, but like when nurses, I'm sure I'm maybe some of you guys have like rolled your eyes like, oh, these nurses that constantly complain about, there's not enough nurses at the bedside and the healthcare systems aren't helping them. But you guys do understand. Maybe you guys think that nurses are being selfish, but you guys do understand that by nurses advocating for themselves to make their job easier, sure, it might sound like nurses are whining all the time, but by them advocating to make their job easier is also advocating for you in return because you guys got to understand the harder your nurse's job is, the more likely you're going to die in the hospital. It's just facts. It sounds kind of like gruesome, but
Yeah, the increased risk of medical error
yeah,
and
and the more stressed your nurse is throughout the day, and the
mhm.
more patients he or she has in that unit, the more likely you're not going to get enough time for your care that you need. And people think, oh, they're there for 12 hours. What are they doing for 12 hours? Like, you can do anything in 12 hours. Well, when you have four patients and you have to be extremely good at time management as a nurse, you have four patients and you kind of have to distribute that time out. You have 12 hours, but each one of those patients might be getting 2 hours throughout the whole day. Or I only have like 2 hours to do all of these things for you. Pass meds, get
Neuro
your
checks
labs.
every hour
Yeah,
that take
do
30
your
minutes
assessment,
and
make
then
sure
you go
nothing's going on with you. We are the grunt workers in the healthcare system. We're your last defense as a nurse. So like a doctor could order anything, say they accidentally ordered something for you that belonged to another patient, it's your nurse's job to catch that kind of stuff. So a nurse is extremely vital. So when you guys hear that there's a nursing shortage, we the public really does need to do something bigger than what they already are. Like they need to step up too. It shouldn't be just nurses advocating. So instead of you guys thinking, I know people think this, that they're tired of hearing nurses like whining about their job. It's not just because their job's hard, but you guys do understand that nurses have a high stress job where they're actually taking care of human beings. Like if they fail to do their job, that means something bad happened. And it is traumatic for a lot of new nurses, especially, or even it doesn't matter how many years. You could be a nurse for 20 years, and if your patient dies in front of you, it doesn't get any easier. And if they die because you didn't have enough time to take care of them, that's super hard to deal with. Like it's almost impossible not to take that home. So by nurses whining and complaining about how hard their job is, well, they're really advocating for you. So if you ever do end up having to go to the hospital, God forbid, that you'll actually receive the amount of time and care that you need to survive. Because if you don't have nurses, you aren't surviving. So
preach.
yeah, so that's just something we wanted to talk about, and there's lots of different things that we could go from there about why there is a shortage. I mean, I'm not going to go into all of the things because it's a pretty much a multi-dimensional thing where whether it's not enough experience, not enough pay, people talk about the pay quite a bit, which I agree. Nurses, based off their skill level, should be paid more because there's other professions out there that don't even have a degree and they're getting close to being as paid as much as a nurse
Mm.
is. In my opinion, $30 an hour is pretty unacceptable, even as a new grad nurse, which I know that's like the starting rate for a lot of areas, but this depends on where you live. But um, pay is a big one. Healthcare system not supportive is a big one. You're put in crappy situations constantly because you don't have enough nurses. And the more toxic your hospital is that you work for, the more terrible your job's going to be and the more high risk it's going to be. That's another thing. People don't talk about, I know I'm ranting a little bit, but people don't talk about how nurses, they work and they can get sued and put in jail for working. Is there's not very many other jobs out there that can actually risk your actual personal life by going to work. I can go to work, and if I make a medical error and I get sued, then that means I could potentially, well, of course, I'll lose my license for one. Then there's my livelihood that I just spent all my life for. And then number two, I could possibly get thrown in jail just for being a nurse. The more toxic or unsupportive your healthcare system is, the more likely that happens to you as a nurse. So it is a big deal. And it's not just selfishly thinking about nurses, well, in turn, you're, advocating for literally everybody who is eventually, odds are going to need some sort of healthcare in your life. Because, of course, modern day, we're not just going to let people die out in the streets. So, if you need something in the hospital, well, you better hope that your hospital system's supportive of your nurses because that's life or death. Um, so that's just our opinion. But next thing we wanted to transition into was nursing violence, and of course, that's also another factor of nursing shortage. And we had a story that came out in December of a nurse who was a home health nurse, and they visited their patient in their home, of course, traveled to their house to help give them medication. And then next thing you know, she went missing, and then they found her in the basement of that patient's house. He killed her, and uh, they found her dead in the patient's house. So that's another thing you could
It's
find.
terrible.
Yeah, you could literally go to Google and type nurse killed, and it would probably pop up every single state. There's a news story coming out that a nurse got killed like every other week or every month. That there's nursing violence going on, and that's another thing with hospital systems that there's really not much out there that really prevents or secures nurses' safety.
Mm.
Because especially in the emergency department, you'd be putting around some, of course, criminals.
Mm.
But when criminals, especially, get sick or they get there's a lot of psych going on in the ED. Of course, they do have police officers there, but there's really not, especially in those rural areas where you don't have a whole lot of police.
Yeah, any resources?
No, and like we just talked about the home health nurse who has no backup at
Right.
all. It's pretty scary because nurses get put in dangerous situations all the time, and there's just seems to be nothing that is preventing that from happening.
Yeah.
Like if someone wants you're put in a dangerous situation. We live in the Dallas area, and it was at least a year ago now, maybe 2 years ago now. There's a hospital in the Dallas area that person came in with a gun, just walked right through and started shooting people.
Hmm.
It's just it's just crazy. So that's I know a lot of people, especially nursing students, we hear about them concerned about nursing violence, especially if we work in the ED. But that it's just sad, you know, that there's lots that we probably could do, and that's kind of goes off of like school shootings and everything too. Is that there's a lot of ways that we can actually improve security in those kind of high risk environments, and
Because they have money.
yeah, and they
Yeah.
decide not to.
I know that there's some like emergency departments in downtown areas that have like metal detectors, and
Yeah,
they check your bags, make sure that you don't have any, weapons on you and things like that. But I mean, obviously not every place has those resources.
yeah.
And
Just
yeah,
having those
so
resources could save a life, pretty much. So,
hmm
but yeah, I mean, I work.
when enough people come together, I feel like things get closer to something.
Yeah,
When enough people come together and bring them facts and what's the issue and what's a good resolution. And I mean, hospitals have money. I mean, they have a lot of money,
they also,
and
they get
they can
supported by government
yeah,
agencies as well,
they
especially if
can
they're
afford
nonprofit.
they could probably afford metal detectors, cuz or another resource officer sitting at the front just checking bags or pockets, or
Yeah,
going through a metal detector. I mean, I feel like there's simple ways that would make a difference.
yeah. There's absolutely no reason that someone with a gun can walk straight into a hospital, go up to like the eighth floor where the
They
maternity
were in the
unit
yeah, it
is.
was the L&D.
Yeah, where a patient just delivered a baby, and that dude has a gun, and he's shooting healthcare
Yeah.
worker, shot a nurse, killed a nurse, and also I think a nursing assistant, and also I forget who else he shot. He didn't shoot the patient though. I
I,
don't think.
did he shoot himself?
I can't remember.
But
But anyways, it's just
I mean, he
ridiculous
had
that
easy access
just walk
to
right
a
through.
floor.
Yeah,
Yeah, it's
it's
crazy.
ridiculous, and
It is crazy. It's crazy to think that there's easy access to like any floor on a hospital unit, because what if someone, I mean, I know you have to badge into certain areas,
yeah,
but like there's a lot of areas that are just open. Like you could just walk right through the front door and take someone's IV out or take their med and
Yeah.
stick it in,
Yeah, there's a lot of
I
like
mean,
foul play that could happen in a
yeah, it's
hospital.
just and there's a lot of I mean, there's like a lot of things people could use as weapons. They could just come right in and, I mean, and every person or patient there's vulnerable
Yeah.
because they're sick or in a bed or so it does seem crazy like to think about how
Wide
accessible
open.
any floor is on a hospital in a hospital.
Yeah. Like I'll tell you, like I worked in ICU, I get angry people all the time. So like, what's telling you that they don't come back and bring their gun next time they come in the hospital and
Yeah.
come after you and target you because oh you didn't do this for my dad or whatever, or they blame you like it's your fault because a lot of people do blame
Yeah.
the healthcare workers or the doctors. Doctors are always like
Yeah.
they're always in a dangerous situation too because
Hmm.
if they feel like they're not doing what they should, then if there's mentally ill people out there, then you're at high risk for being attacked. Like all healthcare workers are high risk for being attacked
Yeah.
because they're
They
in
get the
the
blame for
stress.
yeah.
Everybody's in the hospital with stressed out people around you, so
Yeah.
there
That's the
definitely
worst
needs to be
part of a
more.
lot of people's lives is being in a hospital.
Yeah, and people in general don't need to go to work and have to worry about their safety. That's just not
Yeah.
fair,
Yeah.
especially especially someone who's trying to save lives
Yeah.
and prevent death from going on in the hospital, and then that happens. So it's pretty unfortunate. But that home health nurse. I mean, what do you do? Like there, like there's something that maybe you could have done. Like if it's a violent person, maybe you require
I mean, who
a
you're
supervisor that comes through. I don't know, but that's a pretty unfortunate
yeah.
situation. That
I mean, yeah. I mean, I don't know how you would prevent that. I mean, I did home health and you go into people's homes and you give people the benefit of the doubt.
yeah,
You trust people and I mean, you're in their home, so they could do whatever they wanted to. You're not out in the public.
yeah,
You just have to make sure that as a nurse, you check your surroundings and you're safe. You have an Apple Watch on that can, call your emergency contact or call 911 or you have to think about those things. And I mean, you should always be thinking about those things even when you're out shopping or,
yeah,
you should always be thinking about like what can I do when I'm in a situation that, I need to call someone. But I mean, that's just so sad.
yeah. It
It's
is.
terrible.
Yeah, so we're next thing we're wanting to talk about is the medication issue in our country, and kind of how like pharmaceuticals has controlled the entire healthcare industry in the U.S. So
And
as
insurance
nurses,
companies.
yeah, and insurance companies, yeah. So we were wanting to talk kind of about that and bring some light into that because a lot of people don't really know, the issue about behind medication, and as nurses we see it all the time. There's 90-year-old grandma that has like 25 medications on the medication list, and who knows how many of those medications are interacting with each other or they're
Hmm.
counteracting each other,
Polypharmacy.
or yeah, or causing other more
Uh-huh.
signs and symptoms that that
Yeah.
you won't ever know because you have 25 different medications to look through.
Yeah,
So
I mean, I saw that. So I did home health. So I feel like home health nurses see that like directly, you know, I mean, there's patients out there that have 25, 30 medications, like prescription meds. Like,
yeah,
oh my goodness, if you really think about just what one med can do, I mean, it's it's scary. It's actually really scary.
yeah,
And so I saw that a lot as a home health nurse and most of my patients, like a big trend I always saw was with beta blockers. They lower your heart rate and your blood pressure. And so patients like I had patients that were on beta blockers that didn't even have a blood pressure cuff at home. I'm like, you know that you're supposed to check your blood pressure and your heart rate before you even take this medication because like there are parameters
yeah,
like to hold this medication. And I can't even tell you how many patients I saw that did not ever was never told that once.
yeah.
Ever.
It's a
Ever.
huge. No one knows.
Yeah, and so I mean, I saw patients that would so I had a lot of patients that had orthostatic hypotension, like they would, get dizzy and I mean, I had old patients that would get dizzy and fall. And so like whenever I would have, a new patient that, had recurring falls, I would always check the orthostat, I would always check their blood pressure sitting and standing to see if there was any drops. And a lot of my patients had significant drops, and like they were not taking their blood pressure medications correctly.
Yeah.
And then it would result in a fall, and sometimes that would result in a hip fracture or whatever. And it's just like, oh my gosh, if you were, educated on how to take your medication properly, you would not have a broken hip right now.
Yeah.
Like literally, like that's how, much that cascades into like
Yeah.
a
People don't realize that.
hospitalization and
It's always a
surgery
cascade.
and there's just so many risks involved. And I mean, even patients simply that say you're taking 50 milligrams of, metoprolol, and then you lose 50 pounds, and then the patient's still taking 50 milligrams
Yeah.
after they just lost 50 pounds.
Yeah.
I mean, that medication is not should be changed.
Yeah.
Or it should be their blood pressure should be assessed to see if, it's still therapeutic for the patient. Because I had patients that would lose weight, and, they would tell me, "Oh my gosh, I'm like super dizzy now." And I'm like, "Have you recently lost weight?" "Oh yeah, I've lost 20 pounds." "Oh, and you're still in the same dose?" "Yeah." "Oh,
Yeah.
really? Like
Yep.
for real?" And so anyways, there's polypharmacy. I mean, patients are on so many meds. And you know, it's so crazy to me that um, you know, oh my gosh, I would feel so uncomfortable, just pushing all these like, refilling all these meds for a patient. I'd be scared to order one. That's why I'm in wound care. I'm like, I don't like
Yeah.
meds are scary, and
They
the
are.
amount of polypharmacy in old patients where, they're at way higher risk of, you
Adverse
know,
effects. Yeah.
yeah, I mean, it's just crazy, and it's sad. It's actually really sad.
Yeah.
And the lack of education is really sad because, I mean, it all cascades. Is there not enough time? Or does the patient not get enough time with their provider? You know, like what's the issue here? What's
It's
going on? Because it's an actual issue, and it's kind of a quiet issue because, a patient will go into the hospital with low blood pressure, but like um you don't really ever talk about. I don't know. It just in my head it seems like a quiet issue
yeah, it is. Yeah.
because it's like,
It's
the
not
waters are kind of
discussed.
rocky, and it's not like a, like, oh, you have CHF because, this is your, echo result or whatever. Like, when you're taking like 50 meds, how does one say, you know that this was caused specifically from, it's kind of like it's just a quiet thing where um it gets missed a
Yeah.
lot. So
Yeah. It's these. The biggest issue is that we have a terrible primary care system in the U.S. We're very good. We have very advanced technology. We're very good at critical care. We have really good hospitals that can treat patients very well based off the providers are very knowledgeable. They can treat sick people really well. But like there's pretty much no preventative care in the U.S. That we have insurance companies that are pretty much limiting where they're depicting on how long a physician can see a patient and this is how they bill because it's all like financially driven.
yeah, and I mean,
It's so
they
financially driven. They're like this insurance company's like, oh, this is a 15-minute visit, you see them for 15 minutes. The How about like individualized care where every patient is going to have an individualized issue and that they don't need to be treated like some sort of you know pond where you just throw different products at them, aka medications, and then they we'll come back in another 2 months and we'll just see how it happened. Like, how about like actually looking at the root cause of what's going on with the patient? But you can't ever do that with 15 minutes. Like,
yeah.
I'm sure a lot of people
Also,
are listening is like they go into the doctor's office and they talk to him for like 2 minutes. Like, what is that going to do?
yeah.
Oh, you're having this? Okay, here, take this. It's no like
Well,
actually like, okay, what there's everything in healthcare people don't realize is that something that you're dealing with right now or ended up getting you into the hospital, it's typically not just one single thing. This is something that's been building up. Like events that, compiled into one. And
mhm.
that one event is going into the hospital. It's not usually just like, oh, or unless it's like some kind of car accident or like something that's a direct cause of like what's going on. But a lot of times, like chronic illness, this is multiple things laying on top of each other
Yeah.
that
And
people don't ever talk about because we have no preventative care.
yeah,
So
we have no preventative care. Be- and a big thing is because insurance companies don't cover preventative care. Um, they don't cover a lot of like they don't cover a lot of labs that aren't in your typical like yearly examination. Like there's labs out there that are really important in looking at certain hormonal functions or whatever that aren't covered by insurance, so patients have to pay out of pocket.
yeah,
Your insurance company only covers this once every 5 years or so physicians have like they have to unfortunately go by what the insurance company says, so the patient's not left with a big bill. And if a doctor wants to order like an MRI of whatever, they have to get insurance approval. And sometimes like and whoever's approving this MRI is like, you know, if it's an MRI for like a wound patient, it could be a pediatrician or someone that doesn't even have any idea what your specialty is and all the ins and outs of your specialty. They could deny,
yeah,
you know,
insurance companies.
they could deny your imaging, and it's like, why? And then you have a patient that comes in with diabetes, and you tell your patient, oh, like this is the treatment plan, and it's like doesn't talk about diet, doesn't talk about exercise, doesn't talk about how you don't have to live with type 2 diabetes the rest of your life.
Yeah,
but but people think they do. It's like, oh, I have this diagnosis. You know, no one ever talks about like you don't have to have this diagnosis. Like that's the beauty about our lives is like, if you're fat, like you don't have to be fat.
yeah,
If you have diabetes, you don't have to have diabetes.
yeah,
You know, and we live in a society that's like, oh, it's okay. There's a med for that.
yep,
Just start this med and like where's the diet? That's the biggest freaking thing that should be, talked about. Like and when I was in home health, I tried. I had so many patients that needed like dietary help and like they needed a dietitian. And let me just tell you how many insurance companies or how many resources there were for dietitians like in the home. Zero.
yeah,
I never could get one. And I'm not kidding you. I tried often. And having a dietitian in the home would be the best thing ever because when someone's learning about diet in the hospital, they're like in an acute condition. Like they don't care about their diet. If you go into someone's
yeah,
home, if a dietitian goes into someone's home, they can look in your cupboards, they can look at your kitchen, they can look at, what resources you have or, how your kitchen's set up to see, how you can make this or what appliances you have. Or, I mean, there's just so many things that are lost in our healthcare system
yeah,
that get me fired up.
yeah, yeah. I mean, Lex and I both are very like we're very preventative thinking. Like, there's our country is so reactive instead of proactive. Like it's almost, I'm not going to say it, like I'm not a conspiracy theorist. It's almost that we want people to get sick so that way we can, provide them products, aka medications, to make money.
Yeah.
It's just doctors aren't allowed to be doctors anymore. They don't even get to make their own decisions. Like preventative care is just like, oh, it's actually insurance making all of your decisions. Who could be just somebody who's has no medical background at all, and based off of their policies, all they
Yeah.
are is just policy followers. They can follow, step by step policies that these insurance companies make, so that way they can make sure they're not going under with their finances. So this doctor thinks you actually need this imaging, such as like an MRI. Okay, you really need this, but oh, we have to get approval from insurance company. We have to get a prior
Yeah.
authorization, so that way you don't have to pay out of pocket because you're already paying monthly for your premium. That's even allowing you to come and actually have the opportunity to have these services done for you. But no, they can deny it because
Yeah, but you're like,
they're
I just
insurance
paid you
companies.
$800 for my insurance. Where did you just put the $800?
Yeah, you go to a year your annual visit and you don't like for us like we had insurance and we would go to our annual visit, pay $800 a month for our entire family, and we go to our annual visit. We don't go to the doctor at all. We like,
We go for annuals for like labs
yeah,
and whatever. But
we go annuals, and then I had to pay out of pocket for my annual. Like I
yeah,
had to pay a portion of it. I'm like, what in
yeah,
the world?
you had to
It
pay,
is just ridiculous. Even if it was
your
only like it was less than $100, I don't care. I'm
I know,
paying
I'm like,
you.
I just paid you whatever 800 times 12 is for the year.
Yeah,
Like, where did all that money go? That would have paid for this visit and then some. So
yeah. It's just a
we had
huge.
private insurance,
Yeah,
and we actually switched to like a Christian care organization where
yeah,
you pay into a big everyone pays into like a big pot, and it's you pay your self pay everywhere you go. But if you know have a bill that's like $6,000 or higher than the organization pays for, it's called a MetaShare.
yeah.
And anyways, we are very happy with
Yeah,
that
it's how
switch
insurance should
because
be. It's not
yeah,
they're not trying to it's everyone puts their money in a big pot, and then whoever
it
goes,
gets taken,
if you're
yeah, it
part of the
gets taken.
as a member, then you go if you end up going to the hospital, you have something happen, then
Yeah.
the community pays for your bills. That's how insurance should be. It should be a community driven thing, not a or a corporation that tries to launder money from everybody and then
Yeah.
decide what you get or not get from your health care. Because here's the thing that people don't know. This is a major thing. If you don't have insurance, you don't go into the doctor's office. And let's give it an example of like we're going to pick up our metoprolol. So you go into the pharmacy to pick up your prescription from your doctor, and you have insurance, right? Well, that pharmacist or that pharmacy has to run your prescription through the insurance, and they decide what that price is. Your insurance is telling them what the price is. Well, if you're self pay, let's say like the medication was $2, but the insurance, if it was self pay, it was $2. But now that you have insurance, they're going to bill you $4 for it because
Yeah.
insurance has policies that they have to follow because you're a member from that insurance. So like automatically you pay more for that medication,
Mhm.
and that physician or that pharmacy can't even tell you that their price is actually $2 for the medication because they're not allowed to disclose that information if you're a if you belong to an insurance company.
Yeah,
That is true. So
we paid
that's why we did Medishare.
yeah, we're self-pay, like,
Self
at
pays
the
way better.
dentist, everywhere,
Yeah.
and we're like, "Oh my gosh." Cash pay. And so it's like, "Oh my gosh, we're saving so hundreds, probably thousands of I mean, yeah, we're saving thousands of dollars."
Yeah. And by the way,
And
like,
we pay like what, $250 a month for a family and with a
yeah,
deductible of 6,000 or 12,000 or
I don't know. Yeah, something around there. But we if we ended up actually do like one of us actually did go into the hospital, it's very likely that 100% of it gets paid. So that's
it's
what
not
really
very likely it is
yeah
paid if it's over your
yeah over your
deductible.
deductible. So like that's how insurance should be.
Mhm.
So we're not trying to tell anybody to make life decisions like that, but we are just trying to at least open your
It's just a
eyes to
little
like
pointer,
yeah.
what we've
But
learned.
it's just unfortunate like we have this going on in our
Yeah.
country that we have no proactive care. It's all reactive. They're waiting until you get illness, and then they're like there's no education behind why you got the illness. No, it's hey, take this medication to mask it so that way we can allow it for more years to grow into your body, you know.
Oh, yeah, and then this medication causes 25 other symptoms. So you're
So
gonna be taking, this med, this med, this med, and this med,
yeah.
and then those meds cause 25 other things. So then you're gonna be taking this med, and this med,
Yeah, so that way
and then when you're 65, you'll have 40 medications that you need to take.
yeah, so like you
Have a good day.
take this medication, it's going to cause an issue, and oh, if you have that issue, here's this medication to come help
Yeah.
that issue. That's exactly how it goes. So it's, I mean,
Also also healthcare workers, have terrible insurance, like, we got insurance through the hospital that, Will worked at, and it was absolutely
yeah,
terrible, and the insurance that where I work at offers, terrible, and it's like, "We're healthcare."
I know. If
Like, why
anybody
are
should
you
get like, I'm not saying free, but at least
well,
something majorly
yeah.
discounted, because there are,
Obamacare totally wrecked insurance. It did, it's a fact. It is a fact. It wrecked insurance.
yeah,
It raised premiums. I mean, it ruined health insurance.
yeah. It's, I was just gonna say like the if anybody should get good healthcare insurance, it's healthcare workers because there are people who get free healthcare. Like there's programs out there, such as like the federal workers and stuff like that. like at least give like healthcare workers some sort of like discount. Even doctors are like, if anybody,
Yeah.
doctors should be getting really good healthcare uh, programs for insurance, and they don't. They like, they get paid. They have to pay the same amount as most people. You know, like I don't even know if there is very many programs out there for them. It's just crazy to think that.
Yeah.
Like they are healthcare. Well,
Mhm.
you can't say that anymore. Doctors can't even be doctors anymore. They have all this. They went to school for all this. They know like crap ton of stuff, how to save any life, and oh no, insurance company,
Mhm.
you can't do that because of this.
Mhm.
Yeah, it's pretty crazy what
Money
we,
driven.
yeah, and it's I don't know if it'll ever
It's
change,
I
but
was going to
in our
say
lifetime, anyways. But yeah, I mean,
I
there's things
think
that you can do
I
out there
think a
that,
lot of people are opening their eyes up to like more preventative care, just like
yeah, for
just social
sure.
media in general, like the amount of education that social media has brought, like and just the amount of like, oh my gosh, it's such an eye opener to see, these statistics and these doctors coming on and, voicing like what they've seen. And I feel like a lot of people are actually like opening their eyes like, wow, we really do live in a society that does not have any preventative health.
Yeah,
And medications are just thrown at people. And, I feel like there has been a big step in the right direction, you know, especially in our age group. I feel like a lot of people
oh yeah, there's it's a lot more
are,
awareness.
yeah, are a
For
lot
sure,
more.
like there's the healthy lifestyle is getting more popular, I think. So, I mean, who knows? I mean, on the ground it's getting more popular, but who knows about policy, like how that's ever going to change?
Yeah.
Because that's we're against very big corporations that are pretty much a monopoly, pretty much at this point, especially pharmaceuticals.
Hmm.
It's a big business, and a lot of people don't know this is that the United States and New Zealand are the only two countries in the entire world that allow pharmaceuticals to advertise on TV. If that doesn't tell you something.
Yeah. It's almost so obvious. Like they don't try to hide it.
Well, they don't need to, and they
Mhm.
use trends, popular trends to advertise medications. Not gonna say vaccines, but and people think that vaccines are not part of the pharmaceutical industry, but they very much are. But there's lots of things that are going on that people don't really know about, and it's pretty unfortunate. We have a,
We have
a
we have
United,
a lot of people that don't do their own research.
yeah,
Though, you have to do your own research in everything you do, not just, your healthcare.
yeah.
But, people just say yes. Their doctor's like, oh, get on this med. Okay. You know,
Well,
ad advocate for yourself.
there are some people that do their own research, and sometimes it kind of is
Yeah, they're
counteractive.
like,
Like they'll come
yeah,
in like,
Wikipedia told me I had cancer,
yeah, there's or like
but
they'll tell you what medication they need and stuff, which is not always accurate. And so there is that. But I'm more of like saying like on a policy standpoint of like what's the overarching like power in healthcare, and it's pharmaceuticals by far in the U.S. And there's a reason why uh, we have lots of foods that are banned in other countries that is allowed in here. There's a
mhm.
reason why there's not a lot of education in general in nutrition. And by the way, they don't really put a lot of education for medical doctors or nurses on nutrition.
Oh, I can show you my book. I thought this was astounding. Um, when I was studying about just medications in my NP book, there was like a page and a half about like natural medicine,
Yeah.
and there's no research.
Yeah, they don't fund the research for that kind of
Mhm.
stuff because it's not profitable. It's something that's not man-made. They want something that's man-made that can be manufactured and patented by a certain company that it can only be made by this company. They can't patent, what's a ashwagandha. You can patent a version of it, but you can't patent the actual ingredient. Now, we're not saying medications are not like there are situations obviously that medications need to be
Yeah.
used, especially in the hospital. Like medications are there. They're useful in many situations, but
I think
they're
pretty much everyone
abused.
can agree that there is a lot of polypharmacy going on.
Yeah, they're definitely abused. It's like just like anything else, it's drug abuse. It's we're abusing the use of a drug for sure. And like Lexi was saying, is that a lot of people don't understand that every time you take a new medication, you're taking a risk. Like you could be allergic to it, or you could have a completely different reaction based off your biology. of each medication you take.
Yeah.
It's a risk.
And when you're
So
taking 30 meds, how do you safely get off of all those meds if you've been taking them for years?
yeah,
I had a home health patient that
psychotic meds.
he he owned a clinic in Plano, and he had so it was a pain management clinic, but he got patients off their pain meds and did, some natural, like he did therapy and just different stimulation things. And he had the coolest stories, like, and he had a pharmacist working there. He had like a biologist working there to like really help people get off their meds safely, because there's so many intricate things that go into, just our body's processes and getting used to meds. And so there's a huge risk of getting off of them if you've been on them for a while.
Yeah,
And so that's another issue. Like, a lot of doctors will see that you have 30 meds and you have a patient that's saying, I want to get off my meds. And, they'll look at you like, you can't.
yeah,
Like, you can't get off your meds. You've been on them for years and years and years, and what would happen if you got off them? Would you die? Who knows, right?
yeah,
Because I mean, who knows? So it's a very intricate process, and I feel like it takes like a lot of time, and it takes a lot of time, and a lot of doctors, and they don't have that time. They don't have, the resources to have a pharmacist and all these different people looking at, this patient's med list and making sure everything's, they're getting off of it safely. And
yeah,
it's a very intricate process, so a lot of people just, don't do it. Like, the doctor's like, "No, you can't get off of all your meds," and then they're,
yeah.
so
By the way, it's not really the doctors. The doctors aren't the bad guy.
yeah.
They're just not supported in a healthcare system that that's they're not able to do what they want, what they really want to do a lot of the times. There could be great doctors out there and they're just limited on the
Oh, yeah,
resources of what
yeah.
they can actually do because of the insurance companies and the pharmaceutical
Yeah.
companies. They're only allowed to use this company's drug, and
Mhm.
all the deals that go in with it. And yeah, they have to make a living too, so you can't really blame them on
Oh, yeah, there's
provide.
there's wonderful. I
Yeah,
mean, I hope I don't sound like I'm hating on
no,
doctors.
not at all. I'm just,
I'm
trying to point
I'm
out
like,
to people that,
yeah.
there's, us talking about this stuff is just a given. Someone's going to comment and like think that we're bashing on various different things. But all we're saying is that, no, there's a system that runs the US that's not really ran by the people it should be,
Yeah.
people that actually are educated in uh, medical treatments. And, it's run by people who are administrative staff at an insurance company or a pharmaceutical rep is trying to sell based off your health. So,
Yeah.
and you guys, and there's not much to argue with that because, like I said, if you guys didn't hear us earlier, that U.S. and New Zealand are only countries in the entire world that allow pharmaceutical advertising. That should, it's a drug that's man-made and that makes profit off of people's illness. Like, you don't think that's a little bit? So it's it's just crazy to think that we have this. A lot of people back them up too. That people don't really know is you know they're thinking that it's for the greater good. Give these
Yeah.
medications, and it's
Like, there's a time and a place,
there is a time and place for medications for
but
sure. I'm not, yeah. Like in the
but
hospital, you have like that's all I did was give medications in
yeah.
ICU. Like, you're saving a life, you're giving lots of medications, like
Yeah.
lots. That makes sense. Like, you're trying to save a life. Now there is a time and place for them, but preventative care, where we just like, oh, I'm having,
I have heartburn. Here, take this med.
yeah.
Wait a second. Did you even talk about their diet?
Yeah, I bet if you just stop drinking coffee 8 times a day, you might have a
Yeah.
little bit better. But we're gonna take a medication that could
Yeah.
potentially cause
Coffee
an
and
issue.
spaghetti for breakfast? Oh, here's this med.
Yeah, just take this so that
Mm.
way you don't have the symptoms. But we're not gonna
Yeah, continue eating your spaghetti,
continue
and
eating it so
and
that
then
way
we'll increase the dose.
yeah, continue eating it so that way your esophagus is still getting eroded by your gastric acid, and
Yes.
then later on you get esophageal cancer because your esophagus has been getting eaten away your entire life. So these are the types of things that people don't think about because we're nurses. We understand like what goes on with the body and like how things cascade into each other and how chronic illness happens. And the general population out there may not know like things lead into each other, and so the exact same thing happens with pharmaceuticals. medications lead into each other. That's literally true. You get put on a medication, if you're going to start taking something long term, you might want to look into it very heavily and
Yeah, do your own research.
see if it's actually,
Mhm.
and it's not, like I said, it's not the doctor's fault a lot of the times, you know, but make sure you're doing your due diligence on your own health and making sure that this is the right thing for you, because more than likely that medication could potentially cause another issue later on. So, yeah. So I think we ranted enough about everything. There's you know
There's more where that came
yeah,
from.
there's more of that came. We'll probably do another podcast about. We can do a whole another podcast about pharmaceuticals, and maybe we'll eventually. Well, we are having another nurse, coming on the podcast in a few weeks. That controversial topic here, but vaccine mandates that happened, not just for nurses but for a lot of professions, and we're going to talk about
Yeah.
the impact of what vaccine mandates did to people's lives. We can talk a little bit about what how that really impacted a lot of different people, and then specifically,
Yeah.
of course, since we're nurses, we're going to talk about how that happened, what happened when nurses were mandated, and what was the data behind all that. So that'll be interesting. So yeah. But thank you guys for watching again, and we'll see you guys in the next one.